It is my pleasure to introduce our next speaker. Dr. Derek Griffith is a professor of medicine, health, and society, and the founder and director of the Center for Research on Men's Health at Vanderbilt University. He's renowned for his work in reducing health disparities by race, ethnicity, and gender. And he will be signing his recent book, Racism, Science and Tools for the Public Health Professional, after today's session down in the reception area, following today's presentation. So I hope you will join us for the reception and for the book signing. Dr. Griffith will speak about what dental public health professionals need to know about racism as a public health issue. I ask you to please join me in welcoming Dr. Derek Griffith to the
You on? Oh, you're on. Well, thank you, David. It's a pleasure to be here with you, and thank you to Annalise, wherever she just went, for helping to organize all of this. Oh, good, I can move around. So it is a pleasure to be here with you. I am disappointed I didn't have intro music, so when you introduced me that, you know, I come into a song and all that stuff, but we'll arrange. Oh, you can sing. Okay, well, you know, we can redo this, but yeah. But it is a pleasure to be here with you. I'm excited to introduce this work to you and share it with you, have a good discussion with you. Okay. Here we go. So just let me start with some thank yous and acknowledgments. Of course, let me acknowledge the funders that I have currently for the work that we're doing back at home in Nashville, my colleagues and co-editors of the book. No, we didn't write the book, we edited the book, we did write parts of the book, so I don't want to sort of take credit for everything that's in there. But we did assemble the team and herd the cats, if you will, to pull that together. I do need to also acknowledge the team of folks back at the ranch who are still keeping the trains running on time and making sure that everything is going well back at Nashville. So this is my team in the Center for Research on Men's Health. So I'm really thankful for them as well. So we're going to talk about racism. This is usually not a fun topic for people. We're going to try to make it something very practical, tangible, interesting, and not make it something that seems like, you know, what you all usually get in dentistry, which is kind of feeling like teeth pulling, where it's really painful. We're going to try not to make this painful, but make this really useful. Saying the word racism or racist is usually something that is the best way to shut down a conversation. You know, and so it's one of those things that, you know, people often see there's nothing good that comes after talking about this, introducing this topic, bringing this up. But hopefully we're going to fix that today, and we're going to find ways to introduce this topic, bring this up, talk about it in a more thoughtful, scientific way, but then also make it something useful. It's not about judging individuals. It's not about judging individual acts. We're not the police. I'm not certainly the racism police. I don't get a referee's uniform to go in and tell, oh, that was racist or you're racist or whatever. This is not about that. This is really about trying to understand things at different levels. So there are incidents and events and things that sort of happen at an individual level that we can identify, think about, individual acts and so forth, that you may have some questions about why did it happen, how do you explain it, and so forth. What we're really here to talk about today is structural racism, which is why do those patterns of those incidents and events and activities and behaviors happen, and why do they happen by particular things like race? And what causes those racial patterns to persist and exist over time, and how do we look at what are those things, why those things matter by time and place? So that's really fundamentally what we're talking about. So this is not about just looking at isolated individual incidents and those kinds of things, but it's why do these patterns tend to persist over time and place by race? Okay. So my task today is really to talk about three things. Define racism in other sort of basic terms, so we'll also go through race really quickly and so forth. Discuss racism as a determinant of health inequities, and then talk about ways briefly about what you can do and how this may factor into things like oral health equity initiatives and so forth. Some of the practical side of that work is going to come actually from some work that I did with state and local public health departments, really more around racism and other health issues like infant mortality and so forth, but sort of applying those things to this health issue. So just so we're on the same page about a lot of the basics, so I'll fly through this if this seems very familiar to all of you, but the way I'm thinking about this is dental caries and so forth would be the clinical determinants that you would sort of see, what you see in the office and so forth, or what you see in your practice, or what you see in the public health workforce as, excuse me, the primary outcome that you're sort of thinking about, or the main sort of, incidents that you're sort of looking at. You have behavioral factors that sort of contribute to that. And then you have these larger social determinants that affect what behaviors people can do to prevent or that may exacerbate different health issues, like dental caries or like dental oral health problems. But they also affect very directly those kinds of things. So it doesn't always necessarily have to go through behavior. A lot of times stress pathways independent of behavior can actually affect people's health and can affect the teeth and how strong the teeth are, as I understand this. And so you have these different pathways that are really important for us to understand. And so racism is one of those social determinants that influences health. So just to make this as concrete as I can, this is sort of this is the crux of sort of, if there's a, why should you care about this? Hopefully this kind of summarizes it as best I can. Okay. So we're trying to, in public health, obviously, reduce both the rates and the disparities and inequalities from incidence, prevalence of different illnesses and so forth. And so those various health outcomes, who lives, who dies, and so forth, and to reduce those outcomes, improve those outcomes, and reduce the disparities in those outcomes. We have a marker of oral health, such as, again, dental caries, oral cancers, and so forth, that are very practical, very observable, measurable sort of outcome. We're looking at the behaviors that then influence those. And so, of course, a lot of your work, I assume, is really related to how do you adjust those kind of behaviors and influence those factors. But then we're also trying to understand, well, why do those poor behaviors, why do those poor outcomes tend to cluster within groups that we're going to call racist? And so why do those tend to pattern in that way in the United States and in this particular context? And how do those also pattern and cluster with other chronic diseases that also seem to be associated with increasing risk of poor oral health as well? And then we look at these social determinants like access to care, neighborhood access to services, supports, healthier sort of work, places to live, various stressors in people's communities and so forth that directly affect the rates of disease and illness that they may have, as well as the behaviors that may affect those. But what we're also looking at and what they characterize as a fundamental determinant, and we'll get to this, describing this in a minute. I should move this down a little bit. Okay, okay? All right. Racism is called what's a fundamental determinant of health, which means that it influences, I'm kind of stealing my thunder a little bit from later, but it influences the other social determinants, and it influences multiple ones through multiple pathways. And so what makes it fundamental is that when you fix one, it still tends to ooze and operate through another. And so that's what makes racism very different than just other fundamental determinants of care, of outcomes. It's really looking at when you have these different patterns and they vary by race, they tend to still persist by race even when you fix one particular mechanism. So even if you were to fix access to care, you're still likely to have disparities by race because there's still going to be other pathways and mechanisms through which this would work. So that's what makes this a unique phenomenon. That's why we're talking about this, and we need to think hard about what to do about it. Okay, just so again, for the epidemiologists in the room, we had a nice piece in our book, shameless plug, sorry, that Nancy Krieger from Harvard School of Public Health did about why epidemiologists must reckon with racism. And excuse me, without reading directly all of her 6 points, but it's really, I think, speaks to the heart of this as a scientific issue. So we have to deal with this because it increases our scientific rigor. It increases our ability to understand and inform the strategies that we have for how we understand the patterns and the things that we're doing to address and better understand the disparities that we're seeing, to better understand the outcomes and the patterns that we're seeing and how do we need to intervene to address those. It reduces our scientific error or the potential harm that we can have to people. It improves our ability to understand causal inference and understand why race and racism sort of matter in the context of different health issues. It improves our evidence base for how we actually need to intervene and think about intervening within this context. We have to deal with sort of the history of scientific racism and how that's actually affected different patterns of how we've actually studied, how we've looked at different health issues, how we understand where we've actually sought to have innovations in science, that our sort of way of looking at the world and how race factors into that and racism factors into that is a key part of that. And last but not least, it increases critical self-awareness of the people who are actually doing the work. And while that tends to be a lot of the focus of a lot of the training and education, that's not the only place that we need to intervene, but it is an important place to think about how we need to address these issues. So just to get into this concept of race and distinguish it a bit from racism, I love this quote from Ta-Nehisi Coates in his book, Between the World and Me. And he says, "Race is the child of racism, not the father. It has never been a matter of genealogy and physiognomy. It's so much more as one of hierarchy." Easy for me to say, which is why I should know. Rule number one is never to read my slides, because I will always screw up some word on there, even though I beautifully put them on there, but I should know that. But I do it every time, and I mess it up every time. So let's break this down a little bit. A lot of big words here. So the idea here is that racism came first. And we created this concept of races out of the need to explain different things that we were doing and justify those kinds of things. And so we created this concept of race and its persistence, and we'll talk about what that is and where it came from and how it applies in the US context. The idea of it not being about genealogy is the idea of it not being about sort of biology, and physiognomy is about the idea of physical characteristics having some deeper meaning and being mapped onto something that's deeper, more significant, like skin color, breadth of nose, shape of eyes, and so forth, that are supposed to have deeper meaning, that even influence people's behavior, character, supposed to have really deep meaning other than just who does what. And so that's what makes race and racism a really distinct issue. And it's really about putting people on a particular hierarchy in terms of the access to resources and understanding of what those factors are. This is just a quick slide. The part in the middle is highlighting just the fact that the way you characterize and define racial groups is different across the globe. There's a unique history of which countries tend to use particular characterizations of race and racism, but a lot of them have a history of slavery, so this is why this is kind of connected. So without getting too far off into this, I just wanted to sort of make that point. One of the fun things I get to do is teach a class on racial and ethnic health disparities. And one of the main points that I love to ask my students is sort of who comes up with racial categories in the US? And you would think it would be some wonderful blue ribbon scientific body from NIH or CDC or DHHS. They would regularly convene who these folks are, and they bring together the best minds of science and whatever. Nope, not even close. We bring together the best minds of business. We bring together the best minds of accounting, and basically those are the folks in our government who decide and shape the racial categories that we have in this country. And even if you say, well, we don't necessarily have to follow those within NIH, we don't necessarily have to follow those within CDC, it is strange that those tend to map exactly onto the categories that we use within NIH, CDC, scientific categories, and so forth. It's not like we tend to come up with our own. We tend to very much follow the ones that are guided in the census or that are shaped in the census and so forth. The reason we come up with these statistics and why they change every census and so forth is because we need to track things that are related to civil rights laws and monitor adherence to civil rights laws. So that's actually part of the reason why we came up with racial categories, why the government came up with the term Hispanic. So it's those kinds of things that are important in this context. So this is just directly from some of the laws and categories, some of the language from the standards of racial and ethnic classification, that these are not anthropologically nor scientifically based. They represent a socio-political construction, blah, blah, blah. I'm going to stop while I'm ahead in terms of trying to read this to you. But you get the idea that, for those who are, bent on this idea that it really is a scientific category, the people who created the categories are saying it's not scientifically based. So we have to sort of take that for what it is. The other thing that's important to recognize, even in the US context, is we've changed something about the categories pretty much every time we've done the census, because the census is kind of the useful sort of marker of how we define race and ethnicity in the United States. We've changed who fits in what category pretty much every time we've done it since 1790. And the fact that they're not static also should be further evidence of what we're talking about in terms of these not being genetic and biological categories. There's no way between a 10-year period that biology is going to change that much for you to change, not to mention over just a couple hundred years, biology doesn't change that fast. So the other thing that's really interesting that we tend to underappreciate is who's white has changed dramatically over time as well, and we tend not to understand and appreciate that very often. And just so you don't have to think I make this stuff up, and that I'm just sort of, when I say these kind of things, I don't want you to have to take my word for it, I guess is my point. So I've tried to give you, even if I've said something that you're like, there's no way he's right, I'm trying to give you some support for that, some references to sort of support that, so these are just evidence of that. I know you can't read this, but this is from Pew Charitable Trust, and it's a nice graphic because it shows how the racial categories have changed over time. So if you have questions, again, about whether or not I'm making this up, how these things have changed, Pew Charitable Trust has this about sort of the timeline of what the census calls race and ethnicity over time. Okay, so let's think of, yes?
Do black people ever become white?
It depends. So it's a more interesting question than those might appreciate. So if I have one black parent and one white parent, why should it be that I'm black in this country as opposed to being white? I'm as white as I am black. Obama's a perfect example. But it's, so to answer your question, and it also depends on who gets to decide a racial category. So if I'm essentially getting to self-identify what my racial designation is, yeah. I mean, I have a senior colleague who I won't name who used to say, if I want to just live 7 years longer, I should just start checking the box that says white, and I'll have better credit, I'll have better access to loans and care and all kind of stuff, so I can just start checking that box. So I'll live longer, live healthier, live in better neighborhoods and all that kind of stuff. So it kind of depends, on how free we're going to be with these definitions and terms. So I want to get into sort of more details about why this matters. So this is just a useful model, I find, to explain how we distinguish race from ethnicity and how we think about pathways from which race actually matters as it relates to health. So this is a bit old and dated, but I still find it very useful as a way to explain and break down these kind of terms and concepts. So race is this factor that we created, and actually you'd probably say racism and then race. Physiognomy, again, is that term, multisyllabic, wonderful term that nobody really understands, but it's about what are the physical characteristics that map onto things that we say matter and that map onto these things like race. So again, skin color, eye shape, the breadth of nose, size of lips, hips, all those kind of things and so forth. We break those into categories that have meaning for ways that we actually think about affecting health. So if you think about race tends to look at one useful way of thinking about, one of the things, slow down here. So race tends to be a very useful way to look at societal exposure to stress. And if you want to sort of see, race is useful as a proxy for various things. It's not useful as a proxy for genes. But if you think about it as a proxy for who's likely to experience more stress over their life course, it's a very useful proxy for that. So the way he described it even 25 years ago, and it's kind of scary to say that was 25 years ago, but 25 years ago, essentially, 24, is it looks at sort of your risk exposure or stress exposure through that pathway that then leads to differential outcomes. Culture and ethnicity, and we'll sort of, again, break those down briefly, is really more about those don't usually map onto physical characteristics, or historically, by definition, ethnicity is not supposed to map onto physical characteristics. It's really more about belief systems, values, and so forth, and I'm sure we'll get into this in our panel tomorrow with our expert on culture, so hopefully I'm not saying something that he's going to undo tomorrow. But culture is really, and ethnicity are really about, how do people believe, and what are the kinds of things, how do they sort of assemble groups sort of themselves and so forth, and what are those kinds of risk and illness behaviors and values, and how do those connect to how people understand what it means to be healthy, what actually determines health and so forth. But it's about belief systems and values. And so it leads to, or influences very much, the kinds of behaviors or what you'll do if you're not feeling well, or the kinds of things you'll do if you to try to keep yourself healthy. And so if you think about those kind of things, obviously societal factors will influence what you can and can't do, but ethnicity very much influences that as well. Okay, so another key part of this, and I apologize for those of you who, I wanted to do this as opposed to just walking through, here's racism, blah, 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 because what I'm trying to do is basically explain to you why race matters, why it doesn't matter, but also what are some of the common things that we tend to confuse with race, and we tend to confuse with explanations that we tend to use for race. Well, let's just focus on access to care. Let's just focus on class. Well, here's why those things are useful and important, but are not going to necessarily solve the problems that we're seeing as it relates to race. So that's what I'm trying to do in sort of walking you through this part. So for those of you who already know all this, I apologize, but that's why, for those of you who are wondering, he was supposed to be talking about racism. Why isn't he talking about that? He hasn't said that word in a while. That's why I'm sort of walking through this. Okay. So this idea of race versus class, sometimes people will say, well, let's focus on class and not deal with race. We know that poverty and money tend to be a big determinant of health, and the primary determinant of health, sometimes even independent of race. But how do you distinguish and disentangle race from class when particular groups are overrepresented in those who are fitting into lower socioeconomic groups? When you even adjust for indicators of class, yes, it tends to reduce the effects that you actually see, but it also may over-control for some of those factors, because the groups, again, without getting into stats, sort of the groups who you're tending to say are poor or in those lower socioeconomic groups tend to also be the groups that are overrepresented with the categories that you're thinking like Black and Hispanic. So it's not clear which, even though statistically it seems like you're controlling for something, you're actually over-controlling because you're kind of taking into account two things that where you're trying to sort of disentangle them, you really conceptually can't. Okay, so that's where this becomes a real problem. And so the other thing we know in our society is that race is an antecedent to class, or race is an antecedent to most sort of markers of socioeconomic status. So if you break out social class from economic status, which is, SES is just kind of we got tired of saying social class and economic status because it was too much, and it get to doing things like I do, which is slur words together and mix them up and mess up stuff like that. So we just kind of shortened it to SES. But it's really two different things. But we know race actually affects both of those separately. And that it's not that we can't sort of, race affects the class, which is sort of access to networks, resources, people, those kinds of things, job classification and so forth. You can have a plumber that makes the same amount as someone in a different profession, maybe a teacher. The teacher would be seen as sort of a higher class job, but they may actually make the same amount of money. So there's access to resources and networks that comes with being a teacher, and respect that comes with being a teacher that you don't get from being a plumber or being a truck driver, but you actually may make more money, or the same money or more money by having that other job. So that's the importance of disentangling these terms. They tend to cluster together, which is why we tend to lump them together, but that's why they become important. Either way you look at it, race determines both, or race comes before both. It means race shapes each one. So race determines or shapes which one, again, at a macro level. We're not talking about individuals. I'm not talking about individual experience. So go back to what I said at the beginning. This is not talking about your personal history, your personal experience, and so forth. Yes, there are always going to be examples and people who have, trying circumstances of whatever race and ethnicity. We're talking about at a population level and over time. And so when you look at things in that context, these patterns seem to be pretty persistent. And so we're trying to explain why these patterns are what they are. Okay, so race shapes class and who has access to those resources, and it doesn't work the other way around. So that's why this becomes an important distinction. Okay, let's get into what discrimination means. So, and distinguish it from racism. So here's a useful definition of racism. It's not the only definition, but I find it to be a very useful one. So again, I'm going to try to avoid my natural inclination to screw up reading. It's a harder skill than it would appear. Or reading out loud seems to be challenging. I don't know why this is, but for me, it just doesn't work. So the key parts of this definition, there are three key parts. One is racism, again, is defined as a system, as opposed to, again, we're not talking about individuals, we're not talking about individual incidents, we're not talking about discrimination, which would usually be mapped onto individual incidents. We're talking about a system or a pattern of behaviors of what's going on. What's fundamental and what makes racism distinct from other forms of discrimination is it's based on this idea of inferiority. And this inferiority, easy for me to say, inferiority is based on this idea that it really doesn't matter what you do for that particular group, that they're fundamentally and inherently inferior to another group. So what distinguishes ethnic discrimination from racism is the idea that if with racism, with ethnicity, I can, basically socialize you, I can train you, I can give you access to things, I can teach you how to use the right spoon, I can give you, access to resources, I can put you in the right context. And that's going to undo or fix a lot of the cultural sort of misbeliefs and understandings and so forth that you may have. Racism is so fundamental, or the idea of racism is distinct, in that it really doesn't matter what I give you. Doesn't matter what places I put you in. That you're fundamentally, somehow or another, so deeply flawed by these particular groups that there's nothing I can give you, nothing I can do for you, that you are inherently, fundamentally inferior to whatever other groups that you're seen as sort of being in comparison to. That's what distinguishes racism from other kinds of forms of discrimination. And that again, that doesn't even matter in the sense of how people think is not really that important. In the context of public health, what matters is that belief about people's inherent inferiority then maps onto, and the combination of that being a systemic thing, maps onto then the differential allocation of resources and opportunities to allow people to be healthy or to increase their risk of being unhealthy. So those three parts are really what distinguishes racism from other forms of discrimination. Okay. Racism shouldn't be confused with, again, other forms of discrimination for the reasons I was just mentioning. It is really about this inherent, unchangeable, significant inferiority of a people that are defined by this physiognomy or physical characteristics that we're saying is really distinct. So that's what, again, just to drive this point home, that's what makes this distinct and important. Okay. Now, racialization is a newer concept that's basically this idea that even groups that were not considered racist are starting to experience the kinds of things and the kind of discrimination that maps onto what we're describing as racism. So you're starting to see the beliefs about Hispanics, beliefs about religious minorities like Muslims and so forth, take on these particular characteristics or described in this particular way, where you're seeing that people who have a particular faith tradition, are of a particular ethnicity, are believed to have these inherent fundamental characteristics that there's really nothing we can do to do anything with them. So we just need to basically figure out how to do things on a structural level. We can't just continue to try to educate them, give them good jobs and all that kind of stuff, that there's something fundamentally where we need to treat them like their races, and we sort of see their differences as being so deeply flawed, so deeply part of who they are, that there's nothing we can do. And so it's not like we need to expose people, it's not like we need to educate folks, it's not like we need to have, cross religious conversations or have sort of, things where you're actually getting people to talk to one another and so forth and get to know each other's people, that's not going to do it because there's something fundamentally so flawed about these groups that there's nothing you can do. And so you're starting to see that now with Hispanics and with religious minorities, and so you've seen a lot of health implications of that. There's a lot of literature now about the post 9/11 impacts of health, the stressors that came from those who particularly wear the hijab and different other things that sort of show through their attire that they are Muslim and that follow a particular faith, and that those things, because of the discrimination they faced as a result of after 9/11, that those kind of things had very tangible and concrete outcomes and birth outcomes and so forth. Okay, so we've talked about this before. Again, yes, there are things that fall under this broad definition. Yes, you do have hate crimes, poor treatment, and those kind of things. I'm not saying those aren't important. What I'm saying is that's not where we need to put our effort. Where we're trying to put our effort and attention is to these larger structural efforts and try to understand, again, at a deeper level, why do these things pattern in a certain way, and how do they factor into institutions like dental care, like public health, and how do they factor into those in how we offer care, how we offer supports, what are we actually targeting within our health system to address those kind of with those kind of issues, public health system. The fundamental causes part was sort of alluded to earlier. So this is a model from the Dean of Public Health at Drexel University. Shout out to Philly. But again, it's about, so this maps onto the definition that I was sort of describing earlier, that what makes something a fundamental cause, and they've described socioeconomic status initially as a fundamental cause, the folks who came up with that original sort of model, but then they also more recently described racism as a fundamental cause. But you have this idea of this unequal distribution of resources that influences both your exposures as well as sort of your actions to improve health or that may adversely affect health. And then you have these changes in, like I said, the proximal mechanisms that affect health. They're just variations of wording and structure, flip the model on the side of what I showed you before, but it kind of gets to the point that there's this consistent sort of thing. Again, a fundamental cause is something that influences multiple disease outcomes, influences multiple pathways, involves access to resources and how those things can be affected, and also the relationship between a fundamental cause and health can't be addressed by simply fixing one mechanism. So again, if you've ever seen, there's a great documentary, it's a bit dated now, called Unnatural Causes, Is Inequality Making Us Sick? And in there, I'm not gonna remember his name, from UCLA School, oh gosh. Anyway, I'm not gonna remember his name, but I can see his face. Older guy, white guy with a gray beard. That doesn't help you at all. But anyway, he's from a California school. That doesn't help you at all either. So I'm going to move on from this. But he talks about basically if we waved a magic wand right now and basically wiped out all of the disparities by race and ethnicity within the country, it would do virtually nothing to actually eliminate the disparities over time, because the groups who are adversely affected would then repopulate those because of the structures we have in our society. So even if you fix it at a particular point, again, the reason that we're also paying attention to time is because we know, bless you, that these kinds of things matter and that they will repopulate those kinds of things because the structure in place to create those outcomes that we have. So that's why these things matter, and that's why these fundamental causes in particular matter. And so this is just a paper talking about how racism shapes those mechanisms, and you have the overlap between race and SES, but you have these things patterning and that create and continue to perpetuate these differences in outcomes. So one of the last points I'll make is racism isn't sort of a particular event. It's not enough to just look at a particular thing, a little point in time, a horrific event, as horrible as those can be, for addressing a particular issue. You have to look at sort of racism as a process and as something that actually affects different mechanisms and pathways and how we need to address those at a longer sort of period. It's not about intention. I know this is a little inflammatory. I'm sorry. I couldn't think of some better way to get through this relatively quickly. There's also this conversation about intention versus impact. We have a lot of folks who focus on the idea that, well, I didn't mean to do it. And that's important, and we do need to deal with what people's intentions are. But there's also the reality that it has an effect regardless of people's intentions. It's not to say don't worry about people's intentions, but it is to say that just because you didn't intend to do it didn't mean that we don't need to deal with that. Now, The good thing is, hopefully, you can give enough grace to people who do something unintentionally and genuinely unintentionally, that hopefully you develop and build enough of a relationship with folks that you actually are able to have those conversations, have those difficult conversations, that if you genuinely are making a mistake, it should be treated as a mistake. It shouldn't be demonized that you treat somebody like crap because they made an actual mistake. You need to actually create a space in an organization where you actually can have those difficult conversations, where if you have an honest question, those should be able to be asked. You should be able to make mistakes and be able to have those kind of conversations and be able to negotiate and deal with those kinds of things that are really difficult to talk about, regardless of your intention, and be able to deal with and heal both the wounds of actually feeling like you're bearing this burden of generations of privilege and so forth, but also the burdens of generations of oppression. And so you have to be able to bridge those gaps in those relationships and create those kind of networks, but it is really about building relationships with other people. Another just really stark example, there's a concept called administrative evil, and it came from studying how am I doing on time?
Yeah.
Sorry.
You're good on time.
Okay. Concept of administrative evil is this idea that just getting to this deeper into this issue of intention versus impact. So administrative evil came from studying basically the workers during the Nazi Holocaust, and it was looking at like the accountants, the train managers, the people who were the sanitation workers and so forth. And were they doing something? Were they part of the problem is what this boils down to. And so if you were just the train manager and your job was or you're the train conductor and your job is basically to just run the trains, you're not doing anything, you're not pulling any gas chambers, you're not part of a shooting squad, you're not doing anything directly to hurt anybody, but you're just running the trains. Are you part of the problem? So, and are they doing something harmful? They're not, for them, it's just, well, this is just my day job. I'm not doing anything. I'm not doing all the awful stuff that other people are doing. I didn't come up with this crazy system and all that kind of stuff. So the question is, again, it's ordinary people doing their normal professional jobs and can do things that are harmful even though they're not intending to do anything wrong. In the context of public health, I should go back, we have to ask the same questions of ourselves. So if we're part of a system that is perpetually creating these kinds of inequalities and outcomes, even though our job may not be the one where we're doing things intentionally to hurt people, to create differential outcomes and so forth, what responsibility do we have to actually try to change these kinds of things, even though we're not doing anything negative, we're not doing anything harmful in our particular jobs and professional roles. So we have to kind of use that lens to look at ourselves as a field and to say, what can we do differently? Racism does have an effect on health, and so these are images from, or this is an image from a campaign in Australia that looks at sort of how it affects health and health over time and so forth. And so now the crux of sort of, what are some things you can do? Now, of course, I'm going to shortchange this part because I have no idea. Just kidding. I'm just kidding. Just jokes. Just jokes. But some of these are going to be relatively practical, and they're kind of things I've alluded to before. Basic things like continue to ask questions about why do these differences in terms of oral health vary by race? But ask it in a way that takes advantage of the things that we've talked about, what race is and what race isn't. If race is about sort of access to opportunities and resources, and we know that people have differential access to resources and opportunities, and we know that that's only part of the problem, how do we continue to look deeper? How do we continue to work together to figure those kinds of things out? Beyond just race, how do we think about things that may intersect with race that actually may further exacerbate risk? So things like sexual orientation, rurality, gender, those kinds of things. Gender tends to work in a more complex pattern where men who are, we won't get into the gender part of this, but we know that men tend to actually usually have worse health outcomes, even though we're advantaged in our society. We don't face sexism, we make more money, all those kinds of things. Health is kind of an interesting pattern when it gets to looking at advantage and thank you, and those kind of things. So you don't make the assumption that just because a group is more disadvantaged that we actually see worse health outcomes. So you actually need to do the analysis and hypothesize and then test your hypotheses rather than just make the assumption that you understand what's going to happen before you actually test it. So, okay. Regardless of how your comfort with the term racism and whether or not you actually want to use that term, and we had a actually interesting discussion, I've had this conversation many times, sometimes it's not the best term to open up a conversation with. I wasn't joking, well I was joking, but not really, that that's not really, again, there's the best way to clean out a room is to either talk about politics or racism, and those two things, or religion. But it's kind of like, you know how to sort of ruin a room or ruin a mood. And those kinds of conversations, you need to get deeper into what are you really talking about. Racism is a term and a concept for these patterns that we're seeing over time, over place, that we need to really pay attention to and grapple with. So whether you're more comfortable talking about differential opportunity structures, whether you're more comfortable talking about differential access to whatever, we can find other ways to talk about those kinds of terms that still need to get at that same point, even if you're not most comfortable with that term. And I'm not going to force and impose a definition on you. I gave you one just for a point of sort of departure. Excuse me, but it is important to sort of grapple with these deeper things and what all that we're talking about, and not to water down the definition just because you're uncomfortable with it. So it does need to deal with the assumptions of inferiority. It does need to deal with the structural factors, and it does need to deal with the fact that these kind of things do have implications for tangible access to resources that we know very much matter in terms of shaping who's healthy and who's not in our society. As much as you may not like the term race, and I know there's been a lot of conversations over the years about let's get rid of the term race, let's just use ethnicity, all those kinds of things. Race still remains, unfortunately, a very useful term in being a proxy for who has access to resources in our context here, who has access to optimal oral health over the life course. We can still look at it by race and still see those same patterns, and we still need to grapple with that in our US context and in globally as well. We need to, I would think that particularly in your field, because you're sort of as I understand it, an amalgamation of different areas and you're coming at it from different places, that it's going to be important to stay on top of the literature that's looking at these kind of patterns and factors from outside of dental public health and bring them into dental public health so that you're making sure that you're staying up with the state-of-the-art literature in that space. And that's going to be an important part to make sure that you're keeping, that the field here is keeping up with those kinds of things. As much as there's a tendency in certain areas of epidemiology and other factors where you may not sort of be so hypothesis driven and hypothesis focused, you may just sort of do analyses and then describe things. It's preferable from a scholarly standpoint and to in fact move the field forward to hypothesize why you're expecting to see those differences in variables. So let me slow down and say this differently. One of the bigger challenges that we have in understanding racial and ethnic differences is that we don't spend enough time to think about what does it mean to have those differences, why do they exist, and then if we actually see them and we see the magnitude of them, what does that mean? We don't have those hypotheses before we actually do the analyses, so that we come up with explanations and interpretations that may not be as thoughtful as had we actually gone to the literature and based those hypotheses and analyses in what we actually need to know and what we're actually trying to better understand ahead of time rather than just looking at them post hoc. And so unfortunately we do tend to do more of that than we need to. Look upstream for more comprehensive examples of, or explanations, of patterns of oral health outcomes. And again, even though, we shouldn't necessarily just assume that population level differences either exist or not, but we need to really sort of think thoughtfully about what those things are, how do we explain them, how do we understand them, and don't think that those things apply to individuals. So if you see someone who fits a particular physiological profile or checks a particular box that would put them in a particular risk category, just because all the literature has said that those things apply to that particular group, they may have these particular beliefs. They may tend to look down as opposed to look up all these different sort of cultural shortcuts that we tend to have and stereotypes about different things that we think are actually useful, they may not apply to individuals. So even though they apply at a population level, you need to ask individuals when you see them if they apply to them. Thank you. And so when you're dealing with people at an individual level, you need to make sure that whatever assumptions that you're making about the boxes that they're checking, whether it's gender, race, and all those kind of factors, do those assumptions that you're making about them actually apply to them as individuals? Wow, I had more. And so make space again for people to ask and honestly grapple with questions like these. And then understanding, again, this is not about personal beliefs, feelings, and so forth. This is really to trying to get to a more collective understanding of how to deal with these issues. And as a scientific concept, if you got a better one, I'm open to it. And I'm sure the field is too. But at this point, this is the best sort of simple sort of term, a comprehensive term that sort of gets us to this deeper sort of understanding of these patterns that we have at this particular point in time. So it's really not about, we have to get beyond focusing on sort of individual level beliefs and values and so forth, even as professionals. That it's really not about sort of your, what you've been taught about, what this means and so forth. It's really about how do you explain these larger patterns that you're seeing and what can we do about that as a field? So just to recap, I wanted to define sort of race, racism, and these other sort of terms, discuss sort of racism versus some of these other terms and as a determinant of health, and then talk about, again, some of these ways that you all as a field, or we hopefully as a field, can address these kinds of things in relation to oral health equity. Just to close, one of the most famous quotes from the early part of the 20th century came from W.E.B. Du Bois in his book. Wow, this is why I should put stuff on slides. The Souls of Black Folks, sorry. The problem of the 20th century is the problem of the color line. More recently, in the 21st century, we had a scholar, and this is actually in the National African American History Museum. If the problem of the 20th century was, in Du Bois's famous words, the problem of the color line, then the problem of the 21st century is the problem of color blindness, or the refusal to acknowledge the causes and consequences of enduring racial stratification. So again, my goal, what I leave you with, and hopefully have an exciting 2 days of how do we deal with this racial stratification, how do we deal with these patterns that we see, and how do we do better to achieve and increase equity in our society. Thank you.
Hi, thank
Hey.
you very much for the presentation.
Appreciate it.
Something that caught my attention early in your presentation was that it made it sound like not all countries classify by race, but particularly those that have a history of having slaves. So are there a lot of countries that don't have any classification by race? I don't know that I'd ever given that any thought before, but if I would have just been asked, I would have probably assumed that everybody did that.
I'm not sure, I don't know 100%, so I don't want to sort of answer in that way. What I will say is countries tend to have very different classifications and very different ways of making sense of it, and whether or not they put a lot of attention to it, even if they have the categories. So the sort of, I won't call it rule of thumb, but a way of thinking about it is, in the U.S., we tend to do a great job of keeping track of things by race and ethnicity. We do a really poor job of doing things where we actually characterize things by class and economic status. If you go to many European countries, they do a great job of classifying people by social class and economic status and do a very poor job of actually doing things by race and ethnicity. So it kind of really is not, so I don't know 100% answer to your question, but it's a kind of, each country has kind of decided what are the markers of advantage and disadvantage that we need to sort of pay attention to, that they're going to sort of prioritize in their sort of larger structure, and how are you going to focus on that? So I think that's a safer way for me to answer your question.
Thank you. I don't know if I'm going to be able to word this the way I'm thinking it, so I'm going to just start talking and we'll see what.
Go for it. See what you got.
So I'm in academics, and
Okay.
I'm a young academic myself, but I hope to make this my career for the rest of my life. And I think the challenge that I see in having these discussions with students, because the students will stay the same age, more or less, right? I'm the one that's going to get older, they're the ones that are going to, but I'm going to be working with younger and
I
younger.
get sad about this every
Right.
time.
When they start getting born in the 2000s, then I don't know.
I made a joke about Andy Griffith, and most of them didn't know what I was talking about, and so I had to take a moment, and it was really sad for me. So I feel your pain. Yes, sorry.
I think my challenge is working with younger generations when this comes down to language, which obviously racism isn't just language, but I think that's where a lot of it, a lot of it gets, the discussion gets exposed. For younger generations, they say, well, I don't know what that word means. That word doesn't mean the same thing to you as it means to me. How do we, and maybe this is a very loaded question, but how do we have those conversations? Well, you're right, it doesn't mean the same to you, but, and then, there are things, phrases we can use, ways we can approach those conversations. I'm just curious about your thoughts about.
Yeah, that's an outstanding question. And it's one I grapple with a lot. And that's why I kind of spent more time in disconnecting it from things that we tend to say, well, if we don't need to focus on that anymore. We're kind of post-racial, so we can just focus on, economics, or we can just focus on this, or we need to just focus on that. So my answer, it would depend on how much time you have, honestly. Because I would say what I would do is walk them through, and it's really been striking to students when I'm able to show them data tables of differences by race and ethnicity by men and women, race and ethnicity, by and income, or by educational level. And you see the huge disparities. And you're like, okay, how do we explain this? You have the same level of education. Both of these folks have college degrees. Why is it that one makes fundamentally less than the other by this particular category? When I look at wealth differences by race, why is it one is dramatically 9-10 times different than the other? We're not talking about a couple of points difference or something like that. You're talking about a magnitude of 8, 9, 10 times difference in terms of wealth. What would that do? So I think it's giving them the data and saying, again, the terminology, I don't want people to get stuck on that. I want you to understand what's the phenomena that you're talking about. And why do these things vary by these things? We just, sort of sometimes without a whole lot of thought, check these boxes and sort of don't really think that has a lot of significant importance, and they may not sort of see that as important. They're just like, oh, I just know that I'm supposed to check these boxes. Well, how did you learn that? I have a good friend who's Filipino and black. Her mom is Filipino, her dad's black. And so she remembers very clearly the conversation that she had with her mom when her mom told her, you need to check, when you go to school and you have these forms, you need to check the form black. And she was like, why? You're Filipino. Why would I check the form black? So it's kind of to your point earlier. But it's like, well, because in our society, you're expected to check this form that says black. And because of the one drop rule. So it's kind of like, how do you understand those different things that are making these things have meaning, regardless of whether or not you get into the terms? So I wouldn't sort of get into the semantics of that kind of stuff. Because again, the term racism, just bringing it up and saying it, I'm sure raised a lot of blood pressures for people. I'm like, oh crap, here we got to go with this crap again. Oh no, and it's a black dude talking about it too. Oh God, this is going to be awful. So, it's just, I know that those kinds of things raise that kind of level, but you've got to figure out how to get to the substance of what you're trying to get at. And it's not about semantics. It's about the substance of what's affecting people's health and why are there health differences, even when we take into account the things that we're trying to do well. We're trying to give people access to care. We're just not doing it well. We're trying to do these different things, and yet we're still seeing these racial patterns persist. So help them sort of see, even with all these things that we're doing, we're trying to give people education. That doesn't do it. Trying to give, blah, 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 blah. What is the things that we're seeing that we're trying to do, and despite that, we're seeing these racial disparities still persist? So that's where I would kind of go if you had the time, and rather than get into the semantics and the terminology, excuse me.
Dr. Griffith, great talk. Thank you very much.
Thank you. Appreciate it.
For a very stimulating presentation.
Appreciate
So, Nancy Krieger's point about epidemiology that reckon with racism, how do you measure it? If you can't measure it, if you can't quantify it, some would say, well, it's a soft concept. How do we know we're making any progress? How do we know we really are attacking that critical upstream causal factor for so much else that's going on to account for health inequities? So what's the work on measuring racism, or is that even a concept you can actually put a number to?
So I would be rich and retired if I could answer that question really clearly. There is a lot of work on measuring racism. The problem is it's kind of a chicken and egg sort of in a very circular sort of question. If we can't define it well, then how are you going to measure it? And so we've kind of, and if you looked at, again, I'm thankfully in the right job because I get to nerd out and do all these kind of things where I just spend so much time reading stuff. But if you look at sort of the history of the literature on racism as a determinant of health, it went from looking at things like these structural things, but then because people were trying to get funded by NIH, they realized they couldn't get it through review and other things because there was such contention about how to measure it and whether or not it was even a scientific concept. And so then they got down to measuring, well, let's just look at experiences. Let's look at self-identified experiences over the life course or in different sort of time periods and so forth, or whether or not you've experienced stuff. The problem is, most of the time, if you've experienced racism and you understand it as a structural thing, you don't know whether or not it's actually affected you as an individual. So I don't know why I didn't get that loan or why I couldn't get approved for that particular thing is because of my race or because maybe I really do just have crappy credit and I've really earned this, I did my part to earn bad credit and so forth. And so regardless of who I am, I don't know whether or not that's happened. So the measurement issue is really a fundamental challenge. I mean, in other contexts and particularly in health, and interestingly, this is kind of one of the cautions I have for the way that we're sort of starting to approach Healthy People 2030, is they've moved to really trying to focus on, okay, let's focus on this upstream, these social determinants and so forth, and moved away from, okay, well, how do the measurement of outcomes? And so there's a lot of attention in sort of the early stuff that they've sort of put out about that. The downside of that is, how do you know when you're successful? And even if you can better measure it, you still have to get from that thing to these outcomes. And so I would be more interested in trying to figure out what's the concept. And I don't know that we're going to come up with something where we can fundamentally agree on how to measure it because it's such an amorphous sort of thing. That's why I was there's two ways to sort of think about it. One is sort of an outcome and a process. And I sort of would think about it that way as more as a process measure than necessarily as a cause where you can actually adequately define it. And so I think it kind of, we haven't gotten to the science where we're that good at being able to define it as a term or as a measure that we would then be able to do those kinds of things to then look at as a determinant. So for me, I'm not there yet, but we could go hang out with the folks in Boston and, have some clam chowder and see what they say. Hi.
So I'm leading by example. We can't see you when you ask questions at your end. So stand up. So my question for you is, could you address inequity within race? And very specifically, I'm an Indian Health Service doc originally, so a Native American example, where my dental assistant's brother, pharmacist, went and studied, came back to the reservation, and was not accepted. He was known as an apple. You are red on the outside, you are white on the inside. So not to be pejorative, but have you ever been thought of as an Oreo? Black on the outside, white on the inside, you're a man of privilege in some respects. How do you address from within your own race that challenge? Because and Terry, the pharmacist, committed suicide over it.
Wow.
So it's a very personal type thought.
It is. So how do you deal with it? And so there is the concept of internalized racism. And in some of the earlier work of Kamara Jones, that was kind of one of her core sort of components. I think when she originally conceptualized it, she talked about it more as an individual thing, but one of the things you're raising is that can be something that's part of a population and how those kind of things are experienced at a population level, and it creates division within populations. Yes, I've experienced that. I haven't been called an Oreo yet, but we'll see. I've been called other things, particularly from the perspective of working at predominantly white institutions in Black communities, and am I doing something that is harming Black institutions? So I work in a city where the institution where I work hasn't had the best relationship, to say this as kindly as I can, hasn't had the best relationship historically with the Black community in Nashville. Particularly relative to some of the historically Black institutions that have been sort of the anchor and supportive of the community and really been part of the community and really served the community over time. So they see me and they're like, why aren't you working at HBCU? Why are you working for these other folks? And sometimes it gets to be sort of this tension, between the two. And there's really not going to be a good answer that's going to satisfy anybody other than me leaving and going to work at the other institution. And that's not really an option, for me. One, they haven't made me a job offer. But to be more serious about it, there's a need to deal with that too. And that does need to be part of this conversation. In other communities, there's an idea of colorism. So depending on your skin color, there's sort of a lot of tensions between sort of folks. There's, I've heard sort of depending on sort of facial features within other communities, that those kinds of things, even skin color and just kind of facial sort of characteristics and so forth, you may be seen very differently. So there's a lot of work that needs to be done and has to be dealt with. There's a lot of pain and trauma that sort of has to be dealt with, that we have to figure out how to deal with within that population as well. So it's really more of a both and than necessarily an either or for me, that both that trauma of how people internalize it and then how they turn it on other people within their particular group, is part of the picture. So it's really, all of these things need to be dealt with simultaneously, more so than anything else. Yeah.
Thank you so much, Dr. Griffith. We appreciate it.
Thank you.